Hello everyone and welcome back to this 2-minute revision series, and this time we'll be talking about ulnar nerve. Ulnar nerve originates from the medial cord of the brachial plexus, and then ulnar nerve is seen passing behind the medial epicondyle, and in the distal part it is seen passing superficial to the flexor retinaculum. After medial epicondyle, ulnar nerve it passes between the two heads of flexor carpi ulnaris, and that space is called as a cubital tunnel. And the distal part, ulnar nerve is passing through a Guyon's canal where it divides into a deep branch and a small superficial branch in hand. Ulnar nerve in forearm, it just supplies flexor carpi ulnaris and medial half, importantly the medial half of flexor digitorum profundus muscle. Whereas in hand, the superficial branch just supplies palmaris brevis, and deep branch will take care of the majority of the muscles of hand like hypothenars. It supplies all interossei. It supplies the medial two lumbricals, that is third and fourth lumbrical, and it ends by supplying the adductor pollicis muscle. If we consider the ulnar nerve injury at the higher level and the lower level, now what you will see that in both the cases there will be ulnar claw hand, but opposite to what we expect, there will be less prominent claw hand if the injury is higher. And the reason behind that is the flexor digitorum profundus muscle. Now, flexor digitorum profundus muscle is inserted to the distal phalanx, so it is responsible for the flexion of the distal interphalangeal joint. And because in higher injury, the FDP is denervated, so there will be less prominent claw hand in higher injuries. Also, adductor pollicis power can be tested. Adductor pollicis muscle can be tested by the Froment's test, in which a patient is asked to hold the piece of paper between the thumb and the index finger. And because adductor pollicis is not working, so patient will be compensating it by flexing the interphalangeal joint of the thumb to hold that paper. Also, interossei muscle can be tested, especially palmar interossei can be tested by asking the patient to hold the piece of paper in between the fingers and not allowing it to release, and that test is called as a cart test. The cart test is specifically done for the palmar interossei, which are responsible for the adduction between the fingers.